Ketamine. Rave drug? Therapeutically, it might be time to rave about this drug. Ketamine began as a veterinary anesthetic in the 1960s, but was approved by the FDA for use on humans in 1970. It was subsequently administered on many soldiers during the Vietnam War. It was used in surgery as anesthesia because of its dissociative properties. Simply put, it separates perception from sensation. Taken in high dosages, a person might experience a non-ordinary state of consciousness, out-of-body experience, physical paralysis, hallucinations, possible ego dissolution. Research in the past 20 years has shown ketamine can be a potent tool for treating depression, bringing relief quicker than antidepressants. Antidepressants can take weeks or months to bring relief. One dose of ketamine can alleviate depression within 24 hours. Ketamine has changed the way researchers think about depression. It is not necessarily caused by a chemical imbalance in the brain, low levels of serotonin for instance, but rather, as a new theory suggests, is a disruption of brain circuits. Studies have found that stress, a well-documented cause of depression, depletes synapses in the prefrontal cortex and the limbic system, the mood centers of the brain. Numerous studies indicate that ketamine appears to stimulate growth of synapses, rewiring the brain to regulate mood for those with depression. Infusion, taken via an IV drip, usually at a clinic, is the quickest way to get ketamine into the bloodstream. An intramuscular injection, typically administered into the shoulder or thigh. Nasal spray, taken under a doctor's supervision. And orally, where it is placed under the tongue. Ketamine can be abused. Chronic use can damage organs. The most common long-term effect is damage to the bladder and urinary system. Binge use and using in combination with drugs or alcohol can result in a fatal overdose. Ketamine may help someone come out of the dark, so they can dance in the light once again.
Psychable does not encourage illegal activity, including the illegal sale, purchase, or use of controlled substances. Psychable content is for informational purposes only, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you've seen in a Psychable video. If you are experiencing a health emergency, immediately call 911.